Amigos, feliz viernes. Hoy es viernes. Yo soy Rory y estoy contento de estar aquí contigo. Today, we're continuing on with our series of the 6 essential medical Spanish verb tenses. And today, our topic is the conditional tense, la condicional, in order to say things like would and could and to give that sort of subtlety to verbs. And you can see throughout the presentation that we'll also be looking at some ways that we can use the conditional to kind of soften up some instructions and things like that. So let's jump right in with some ejemplos de la condicional. Creo que su hijo está bien, porque si no, no estaría tan activo. I think your child is okay, because if not, he wouldn't be so active. No estaría would not be. Si le duele el estómago, debería tomar los medicamentos con comidas. If your stomach hurts, you should take the medications with meals or with food. Me gustaría hacerle unos análisis de sangre. I would like to do some blood tests para ver sus niveles de whatever it might be en la sangre, to see your levels of, whatever in la sangre. Preferiría esperar o regresar en media hora. Would you prefer, and it's not do you prefer, right, where there's a would you prefer to wait or come back in half an hour? Y otro ejemplo final, una fractura sería más dolorosa y no sería posible mover el brazo. A fracture would be more painful and it wouldn't be possible to move your arm. So we have all this would, subtlety with our verbs in the conditional tense, okay? So, el primer paso normal de conjugación. So for most verbs, the first step, and for most verb conjugations, the first step of conjugation is to take off the AR, ER, or IR. But, so for example, like a verb like examinar, we take off the AR and we're left with examin, right? And respirar, we're left with respir. Or ER verbs, comer, we're left with com. Beber, we're left with beb. And sufrir, we're left with suffer. Vivir, left with viv. Okay? So that's the first step of most verb conjugations. But with la condicional, we don't have to do it. So we are going to actually stick with the full verb and then add our endings afterwards. So instead of removing the AR and removing the ER and removing the IR, we're going to keep them there and then add our conjugation later. And la misma conjugación para todos los verbos. So we don't have to worry about AR, ER, IR verbs because they're all going to take the same endings. It's a great, easy tense to conjugate. So yo is going to add ia. So examinaría. Tú ias, respirarías. And ella, usted ia, comería. Nosotros íamos, beberíamos. And ellos, ellas, ustedes ian, sufrirían, etc. And so here we have our full examples with examinar. Yo examinaría, tú examinarías, ella, usted examinaría, nosotros examinaríamos, ellos, ellas, ustedes examinarían, right? And then we've got comer, comería, comerías, comería, comeríamos, and comerían. Okay, bien. So conjugation is super easy with the conditional tense. Yes, there's a handful of irregular verbs. So decir, which is to say or tell, becomes dir. Okay, so the stem is going to change. It's dir. Hacer becomes ar, and poder, poder, poner, ponder, and then querer, quer, saber, saber, and salir, salder, and tener, tender, venir, vender, okay? And so the ending, though, that we add is always going to be that ia, ias, ia, iamos, ian. So yo gets ia, tú gets ias, ella, usted, ia, nosotros íamos, ellos, ellas, ustedes ian. Okay? Super easy to conjugate. Let's practice a little bit. Okay? So here we have our endings. Ia, ias, ia, íamos, and ian. And then we've got our irregularidades there. Decir, hacer, poder, poner, querer, saber, salir, tener, and venir. So those are our irregulars. Here are the endings. Okay, so let's take a look at some práctica. Entonces, número uno. poder, to be able, usted quitarse la ropa y ponerse esta bata. So basically we're saying, would you be able to take off your clothes and put on this gown, please? Okay. What are we going to do with poder? Podría. ¿Podría usted quitarse la ropa y ponerse esta bata? Okay, let's do number 2. Yo preferir esperar una semana más antes de cambiar los medicamentos. Instead of saying, I prefer to wait another week, we're saying, I would prefer to wait another week before changing your medications. So yo, put me on pause if you need a second. Preferiría. Yo preferiría. Tener. Usted tiempo el lunes a las 9 de la mañana. So we're saying, would you or like might you have time Monday at 9 a.m.? Tener. Tendría. Tendría usted. Gustarle. So this is like the me gusta, le gusta, te gusta, right? Esperar aquí o regresar en 30 minutos. So instead of saying, do you like, we're saying, would you like to wait here or come back in 30 minutes? Gustarle. Le gustaría. Would you like? Nosotros le en dar anestesia local, no general. Basically, here we're saying, we would give you local anesthesia, not general anesthesia. Nosotros le dar. Nosotros le daríamos. We would give you. Sin los medicamentos, la presión estar muy alta. So we're saying here, without the medications, your blood pressure would be very high. Sin los medicamentos, la presión estaría muy alta. Okay, great. So you're seeing the conjugation is super easy, and it adds this sense of could or would to a verb. All right, so think of, here are some possible uses that you might find yourself, as you think about how you talk to patients in English, you might find yourself phrasing things this way, and if so, then the conditional tense is perfect for you. You might say something like, I would prefer. Yo preferiría. Would you prefer? Preferiría usted? I would like. Me gustaría. Would you like? Le gustaría. I could. Yo podría. We could. Nosotros podríamos. Could you? Podría usted? Okay, so if you could find yourself talking in a would, could type setting in English, then the conditional tense is perfect for you. All right, so let's keep going. Para practicar con su compañero. To practice with your conversation partner. Take one patient profile. So what's a patient profile? It's a patient that you see, week in and week out, that type, that sort of profile of patient always is in the clinic with you or always in the hospital with you. So take one of those and at a time and talk through ¿qué podría ser la causa? Think of their presenting problem or their set of symptoms or things like that. What could be the cause? ¿Qué haríamos en cada situación? So maybe you come up with for lower back pain, you come up with 5 possible causes, right? So, ¿qué haríamos en cada situación? Explain to your partner, if it were kidney stones, you would do this. If it were some sort of UTI, you would do this. If it were some sort of disc or, musculoskeletal thing, you would do this. So just kind of talk through. If you have un disco herniado, for example. If you have a herniated disc, nosotros, and then just talk through what would happen or what would you do, okay? So explain distinctive characteristics of each possible cause. Explain what the patient might feel in each case, and explain what treatment and follow-up paths you would or could take for each situation, okay? Just give yourself a chance to talk through some common clinical situations and what the cause could be, what would your patient be feeling, etc. All right, preguntas. If you have any questions, please post them in the lesson video down below in the comments area. And if you need a conversation partner, be sure to head over to the Learning Medical Spanish Facebook group so that you can put yourself out there and say, hey, I'm working on some conditional tense verbs. Who wants to be a conversation partner? Ok, amigos, gracias por aprender español conmigo. Juntos mejoramos comunidades. Para más español, make sure you head over to the website, commongroundinternational.com. And if you want to take a free medical Spanish terminology test, head over to Certified Spanish, and you can create a free user and create as many and take as many medical terminology tests as you would like. Hey, do something for us. If you like this video, if you learned something new today, be sure to subscribe to it, subscribe to the channel, like the video, share it with your friends. That's how we're able to keep doing this on a regular basis, producing these lessons for you. Thanks, amigos. Nos vemos la próxima semana. Ciao.